And just finally, just a couple more slides. Just making sure that we really do evaluate ongoingly the lab levels, and particularly for those that are on the medications that we're trying to decrease, triglycerides and adjust for LDL and HDL, that we are monitoring those values on an ongoing basis. Key lifestyle modifications that patients with hypertension need to be taught about should include sodium restriction. They need to know particularly types of foods that are going to be the lowest in sodium. Often they will need to go through some dietary education to where they look at particularly things like canned foods that include a lot of sodium. Canned vegetables sound wonderfully healthy, but they're full of sodium unless they specifically say no salt added. So those are things that commonly patients don't always know a whole lot about. And then just kind of making yourself aware of what foods generally tend to be high in sodium, like lots of meats and processed meats tend to be high in sodium as well. Weight reduction may be a lifestyle modification for those whose BMI is 30 or greater. They need to reduce alcohol intake. They need to be put on a standard exercise program if they will, that will work within their lifestyle, so that you're making sure that it is something that they really can do where they live and will fit into their schedule. And then looking at all different ways to decrease stress levels. That might be changing jobs, that might be seeing a therapist, that might be, just doing some meditation, all different things that could help with that. And then avoiding smoking if they can at all cost. Are all some of the key lifestyle modifications. Drug therapies. Some of these drugs are familiar to you and you should be able to pick up on. I won't read them verbatim to you, but as you can kind of see, the biggest things are we're trying to contribute to vasodilation or bringing the pressure down in different methods to kind of keep that under control and keep that at a good level. Many of these drugs are also used for congestive heart failure, so it's always important when you're talking with your patient to go give them a medication in any of these categories. What is their understanding as to why they're on it? Are they on it for heart failure? Are they on it for blood pressure? Or are they on it for both? And so clarification on that is a good thing as you're providing meds. So make sure you're familiar with these drugs and some of the actions that you would be expecting with those. And then just related to dietary and lifestyle, I wanted to give you a great link for some further study. If you'll take a look at this, there's a slideshow. It's self-driven, so it's not recorded. It has a whole content area at the bottom, but it gives you specific foods to look for. Pay close attention to that so that you have the best idea. It gives you other things about lifestyle, and it's self-paced, so you can look through it. It's not real lengthy, it's very simple, but it's kind of, you might want to do it and take some notes on it as you go, just to kind of help with your knowledge base on that. I also wanted to say a last thing about hypertensive emergencies. Often you're going to see orders in the hospital for IV push medications for blood pressure greater than 180/90. You've seen the new standards say 180/120. So on a test question, if you're seeing it, based on standards, go with 180/120 because that's what the guidelines say. However, don't be surprised in the clinical setting if you see orders that give you a PRN dose of a drug like a Preslin or hydralazine that is like 5 to 10 milligrams IV, and then you repeat that, check the blood pressure again, and then every 20 or 30 minutes you check it, and you can usually give up to 20 to 40 milligrams total. But there are serious conditions that can come from hypertensive crises. People can go into stroke very easily with high levels, and so you're going to often see these under your PRN meds as a standing thing that you can give. And then also consider the impact on cardiac and vessel pressure following specific surgeries where the vascular or cardiac vessels have been operated on. These areas are often weak, or somebody maybe has a new stent put in. They're more susceptible to pressures in terms of they've just been operated on and cut into. So in those particular cases, you're going to see totally different orders that may be lower levels than this, where they want you to keep the blood pressure more like in the 140s to 80s range. So just so that you'll be familiar of what you might see in the hospital setting for those kinds of orders. And that's it for hypertension.